Assalamualaikum doctors. In this video I am discussing about Hanoscolin purpura. So Hanoscolin purpura, we know that the pathophysiology is that immunoglobulin A vasculitis. It comes on history regularly. Immunoglobulin A vasculitis, and the features are there is arthralgia, that is knee pain, joint pain, blood pressure is high, hypertension, urine dipstick, red color urine can be present, immunoglobulin A nephritis, so abdominal pain, and purpura rashes. Rashes, the specific distribution is lower leg. So in clinical it comes like chief complaints, complaints of fever and rash. One complaint can become as a limping, can become one day history of any hematuria. These are the chief complaints. So according to chief complaints, actually we analysis and reach the diagnosis. So suppose it's come as a chief complaints is that Omar is 8-year-old, 1 week complaints of fever and rash. So first history, we analysis the fever, onset, course and durations, diurnal and variations, measurement method, medications given or not, associations with rigor, night sweating or abnormal movement. Did they all come together, the fever and the rash? Again, I am telling how can you analyze a fever. First of all, onset, course and durations. Okay, is there any diurnal variations? How can you take the measurement? Measurement method we ask, is there any medication you have given or not? Is the fever association with what? Rigor, night sweating and abnormal movement. Now, did the rash and the fever together comes or not? Then about the rash, how can you analyze rash, chief complaints, onset, course and durations? Describe the rash. Rash on the extensor surface of legs, buttocks and arms with surrounding erythema. So its morphology we are asking, is it raised on the extensor surface, buttocks, arms and with surrounding erythema. This is the description of the Hanoscolin purpura rash. Then distribution, is it elevated, is it itchy, does it disappear when you press on it, oozing or not, punched out lesions, crusting or not, color of the rash. So other concerns are dysmorphic any features and chronic illness. So we first analyzing, then other concern, then going to the systemic review MSK, we are asking here muscle pain, skin lumps, neck swelling, size, mobile, red, hot and painful, hair, nail, lip swelling, hand swelling, peeling of the skin of the hands or feet, bone, pain, joint swelling, redness, number of joint affection, limitation of the movement. So very important, any joint pain, joint swelling, this is feature Hanoscolin purpura supporting. Any lip swelling, hand swelling and peeling of the skin, it is Kawasaki disease, one of the DD we are excluding. Generally we are asking FWASL, fever, weight, activity, sleep, appetite, weight, activity and sleep. Okay. CNS, was vision affected or not? If affected, unilateral or bilateral. Redness of eye, hearing fits, bug in brain, decreased consciousness level, increased intracranial temperature signs, any abnormal movement, weakness, abnormal behavior and hallucinations. So can be present, neurological affection occur. Chest and recurrent bug, cough, dyspnea, musical sound, contacts with COVID and smell lost. CVS, any heart rate in blood pressure, exercise intolerance, awareness of the heartbeat and pallor. GIT about the tummy size and pain and its severity, poo, sore throat, lip fissured or peeled and taste loss. Urinary about the pee, change in color, odor, blood burning sensation, frothy pee, pain in the private area if male orchitis, blood pressure measured. Hematology, any pallor, bleeding, bruising and bug, endocrine, blood sugar measured or not. Past history 5T IOA. That is any trauma, traveling, any treatment taking, any blood transfusion and surgery. Travel, mosquito bite, malaria, tick bite, Rocky Mountain spotted. Then perinatal history as usual, puberty as usual, vaccination as usual, allergy, if atopy, ask in details and allergic march. Nutrition, development, growth chart, family are all. Does any family member has the current COVID? Ask also about their vaccination status or mouth sores, herpes, eczema, herpeticum. So is there any mouth sores? For eczema herpeticum we can ask. Social, financial and home school, last days in the nursery less than 2 weeks, equal lives with the school more than 2 weeks, no need. Psychological impact, how does his condition affect the family? So this is Hanoscolin purpura. We find in the history fever, rash, arthritis, we find there is rash, hematuria can be found. P color we are asking, abdominal pain because we know that perforations, intersusceptions, this can be even pancreatitis. So abdominal pain we are asking. Rash distribution very important for diagnosing Hanoscolin purpura. And the DD of fever with rash, there are lots of DD. I am telling fever with rash presents, very important. Infection cause are bacterial and viral. Bacterial are scarlet fever, group A streptococci. Scarlet fever, we know that meningococcemia, group A streptococcal infection, staphylococcus scarlet skin syndrome, impetigo, infected eczema, infected atopic dermatitis, Lyme and cat scratch disease. Viral or COVID, parvo, MMR, roseola infetum 6 disease, HHV 6, chickenpox, varicella, herpes simplex, and eczema herpeticum, malaria. Rheumatological SLE, JIA, systemic onset and rheumatic fever, vasculitis are Henospleen, purpura, Kawasaki, and PIMS. Hematological is ITP. NAI and abuse should be put in consideration in any case with bruises. So these are the DD of fever with rash. When we take this type limping any history, some red flags we need to exclude. First of all, child age is less than 3 years. Less than 3 years, that is very important. Unable to weight bear. When limping, unable to weight bear, pseudoparesis, any paralysis, fever, systemically unwell, septic arthritis, high grade fever, systemic unwell, lymphadenopathy, hepatosplenomegaly, very important, malignancy, leukemia cause going, night pain, night sweat, again going leukemia, multiple joint affection symptoms lasting more than 6 weeks. More than 6 weeks is JIA, limping. Child age is more than 9 years with pain and restriction of the hip movement. More than 9 years, it is going Sufi, and obese child is present. So these are the red flags of limping I am telling. And how can we take the Henospleen purpura history? Okay, thank you.